Hello, my name is Brett Hiring, Pharmacy Manager with BJC Home Infusion. Today, we will discuss the process for performing your infusion utilizing your IV access and elastomeric device. First, we will identify a clean, non-cluttered surface to lay out our necessary supplies. Next, we will collect our supplies. We will need 2 saline flush, 1 heparin flush, at least 4 alcohol pads, and your medication. Note, it is best to remove your medication dose from the refrigerator 1 to 2 hours prior to your dose to allow it to acclimate to room temperature. This will ensure best possible performance from the elastomeric infusion device. This is also a good time to review your medication label to ensure that you will be administering the correct medication. Now that we have all supplies laid out, it is time to perform hand hygiene. To do this, we will wash our hands with warm water and soap for at least 30 seconds. It is important to work up a good lather and properly clean all surfaces of your hands, paying particular attention to get spaces between fingers and under fingernails. It is best to utilize paper towels to dry your hands, as dish towels can harbor bacteria. If you do not have access to a sink and water, it is sufficient to utilize an alcohol-based hand sanitizer as long as your hands are not visibly dirty, though the hand sanitizer must be at least 60% alcohol to be effective. To utilize hand sanitizer, we will place a dime to quarter size amount in the palm of one hand. Utilizing the same procedure as hand washing, make certain to cover all surfaces of both hands with the hand sanitizer, again paying attention to get spaces between fingers and under fingernails. Then allow the hand sanitizer to fully dry. Now that we have performed hand hygiene, we will put on gloves and are ready to begin the SASH process to administer our medication. SASH stands for saline, administration of medication, saline, heparin. First, get an alcohol pad. We will now scrub our catheter access or scrub the hub with alcohol. It is important to wrap the alcohol pad fully around the threads of the needleless connector and scrub vigorously for at least 30 seconds. Allow the access to dry. Then connect your saline flush. We will then unclamp the pinch clamp on our access. Now we will flush our line using a pulsating flush to ensure that the catheter is functioning properly. If you note any increased resistance to flushing or are unable to flush your access, first ensure that the pinch clamp is fully opened and that there is not a kink in the line. If you are still having difficulty, contact your infusion provider for further assistance. Once we have flushed the access with saline, we will clamp the line. Disconnect the saline flush. Next, get another alcohol pad and scrub the hub for at least 30 seconds. Allow the needleless connector to dry completely. Remove the cap from your elastomeric device and screw the tubing from the elastomeric device onto the needleless connector. Open the pinch clamp on your access and then open the pinch clamp on the elastomeric device. The infusion of your medication has now begun. The rate of infusion is determined by the nominal flow rate of the tubing marked on the filter. During the infusion, the elastomeric device will become more and more deflated. Check on the device every 15 to 20 minutes during your infusion to ensure that it is operating appropriately. When the infusion is complete, the elastomeric device will be fully deflated. Prior to disconnecting the infusion, we will again perform hand hygiene as described earlier. After performing hand hygiene, we will don a new pair of gloves. Then, we will clamp the IV access and clamp the elastomeric device. Then, we will disconnect the tubing from the needleless connector, get an alcohol pad and saline flush. Scrub the hub for at least 30 seconds and allow it to dry. Once completely dry, connect a saline flush, unclamp the IV access, and flush utilizing a pulsating flush. Clamp the IV line and disconnect the saline flush. Get an alcohol pad and scrub the hub again for 30 seconds. Allow the needleless connector to dry fully, then connect a heparin flush. Unclamp your IV access and flush with heparin utilizing a pulsating flush. Clamp the IV line and disconnect the heparin flush. You have now completed the process for administering your IV medication utilizing an elastomeric device. Things to be mindful of during this process. Always review your medication label instructions prior to each infusion to ensure correct administration and that you are infusing the correct medication in the event that you are on more than one IV medication. Always make sure to perform good hand hygiene prior to each infusion. Remove your elastomeric device from the refrigerator 1 to 2 hours prior to your dose to ensure optimal performance of the device. Times when you should contact your infusion provider. If your catheter is not functioning or allowing you to flush it. If your occlusive dressing has become wet, dirty, torn, has blood beneath it, or is coming off. If you are running a temperature greater than 100.3 degrees Fahrenheit. If you begin to develop a rash or itching at your dressing site or anywhere else on your body. Any pain, swelling, redness, or warmth in the arm where the IV access is placed. Any onset of diarrhea or changes in bowel habits.